in Alberta.
Deaths from fentanyl spike in Alberta. As this national crisis grows, we get rare access to a line of defense. Plus, one doctor proposes a radical solution. Are you talking about legalizing it? The government lends a bundle to beleaguered bombardier. And the latest chapter in the federal payroll disaster, lots of workers were overpaid.
That's an enormous figure.
The Canadian opioid crisis is now deeply entrenched in Alberta. Once considered mostly confined to BC, the dangerous drugs have barreled eastward now and rooted down. That's prompting calls for emergency action. New figures released today by the Alberta government show just how bad the situation is. Briar Stewart is in Edmonton tonight. Briar?
Diana, last year in this province, 343 people died after taking fentanyl. The deadly drug has led to a public health crisis and calls for the government to do more. In front of a row of public health officials and first responders, the Alberta government released its highly anticipated fentanyl data.
The number of people dying in Alberta to fentanyl-related overdoses is rising.
Last year, fentanyl-related deaths were up 34% in the province over 2015. 343 people died. 22 of those deaths were related to carfentanil, a drug 100 times more toxic.
And it won't get better until people step up and do something.
Wendy Fleming's 24-year-old son, Daryl Cheer, died after taking carfentanil in October. She's sadly not surprised by the growing number of opioid deaths in the province.
There's no place for these people to go, so they can't get the help. And then it's going to be too late. They're going to be a statistic like our son was.
They've got them.
Unlike in BC, where the overdose epidemic is disturbingly visible on a few Vancouver streets, in Alberta, 85% of the deaths are outside the city centre.
We are seeing increased awareness because the number of deaths occurring in people who live outside the downtown core.
Another difference is that in British Columbia, the province released yearly data looking at all illicit overdoses. Officials there have also given more frequent updates. In Alberta, the new numbers only look at opioids, and so far updates have only been given every 3 months.
So this is an unmitigated public health crisis to do with drug poisoning, and we don't have a full picture of that.
Dr. Hakik Virani says the government's promise today to provide updates every 6 weeks is a good step, but says health officials need to treat the opioid epidemic differently.
If this were any other public health emergency, for example, influenza, we would have 24/7 assessment clinics for people to come to and be assessed for whether or not they have this infectious disease and provided with all the available treatments.
Today, the government announced that an opioid treatment clinic will soon be open in Grand Prairie, Alberta, and all firefighters can now carry and administer naloxone, the potentially life-saving antidote. More first responders will be carrying kits like this one, which contain vials of naloxone and syringes. They're also going to be more available to the public and can be found at pharmacies and community agencies. Diana?
Thanks, Briar.